One such company in this up-and-coming market is StemExpress, the company that buys fetal tissue from Planned Parenthood.
We were approached by StemExpress to do the same thing. One of the Northern California affiliates said, we're working with these people, we love it, we think every affiliate should work with them.
Oh yeah, I like them. Yeah. We know all the people at PPFA pretty well.
CEO Kate Dyer started StemExpress in 2010 with just $9,000. Billing itself as the largest provider of maternal blood and fetal tissue globally, it's grown by leaps and bounds, taking in $2.2 million in revenue in 2013.
I mean, Planned Parenthood has volume.
Right.
You know, because they're a volume institution.
Right.
They partner with Planned Parenthood and they get part of the money. They get paid from it. They do get some kind of benefit.
At the beginning of the day, we would let them know what we were looking for.
Mm-hmm.
You know, oh, we need this gestation for blood sample. We need this for thymus.
So there was coordination between StemExpress and Planned Parenthood to make sure that those orders were being filled.
There was a lot of coordination.
There was a lot of coordination.
A lot of coordination.
Wow.
We would turn on Messenger on our laptops. We'd go to one of the medical rooms and we would open up the task page, which it shows you what the researchers want, how many specimens that they want for that day or that week. And if you were able to get that specimen, you would edit the task page and put how many you had and put your initials. So if it said that we needed a liver with at least 15 weeks gestation, and Jessica was at Alameda or Sarah was somewhere and they got it before me, they would edit it so that way I would come and I'd kind of check the task page to make sure we didn't get double. Roughly saying it was like a grocery list of what to get for that day.
Really?
Yeah. And we'd open the task page, see what we needed. We'd go to the head nurse, let the nurses know, hey, this is what I'm looking for today. They'd give you a sheet of the appointments, which women were coming in, and it would tell you how many patients, what time they were coming in, their name, and if they knew how far along they were. Like if I got a sheet, it would be like this, and it would be clear, down, across. I would take a highlighter. I'd look on the task page. Okay, I need this today. You know, let's say, okay, well, today I need to get this many blood samples, and I need this many gestation. Okay, so, well, it's 8 o'clock now, 9 o'clock, she's coming in. She's 12 weeks. Highlight it. Okay, I need to keep track of her. Go down. Okay, well, at 11 o'clock, we got a 15-week. I need a liver. Highlight her. So that way I could prioritize my day and know who to talk to. Then I would go and tell the head nurse, okay, so I looked on the task page. This is what I need for today. Can you let your staff know? Oh, yeah, we'll let them know. So throughout the day, sometimes a medical assistant would come over and be like, hey, Holly, you said you needed, you know, women that are at least gestated 10 weeks. I'm like, oh, yeah, well, there's one in the room right now if you want to consent her. I'm like, oh, okay, thank you. So it was really just communication. You just really had to communicate. If you didn't communicate, like you were going to miss your specimens, it was not going to work.
What about, so I saw in some of the emails, I was looking back over some of the emails from Sarah and from Jessica and just some of the StemExpress emails that you've provided before. And there was comments in there multiple times where Sarah, the procurement manager, was instructing you guys, make sure that you log on to the computers in the clinic and make sure you get the correct patient schedule and access from the other clinics as well to see what's going on there. Can you tell me a little bit more about that?
Yeah, I've seen Jessica and Sarah log in to the computers at the clinic. They would even let us look at the charts.
They would let you guys?
They'd let us look at the physical charts outside the room. I was even asked to write on the charts at one point.
You were asked to write on the patient chart?
In the patient chart.
Wow.
Which is also, I actually told I believe it was Jessica, and I told her, I said, no, I won't do that. And she said, well, it's part of your job. I said, no, it's not part of my job. That's out of my scope of practice. I could lose my license because of it.